Hello, Overcomers, and welcome back to Connect Over Coffee. Today, we are talking about love, romance, and intimacy with Dr. Saketh Guntupalli. Dr. Guntupalli is the Director of Gynecologic Oncology at the University of Colorado School of Medicine, and he also serves on Ovarcome's Leadership Council and provides us with the guidance that we always seek out from him. So with that, thank you so very much, Dr. Guntupalli, for joining us today.
Thank you, Renzi, for having me. I hope everybody's staying healthy and happy throughout this kind of difficult couple of weeks.
Absolutely, and we greatly appreciate you taking the time out to speak to all our Overcomers. So my first question, what kind of sexual side effects most often impact women with ovarian cancer, and what strategies would you recommend for survivors that are experiencing these side effects?
So oftentimes women that have surgery or chemotherapy for ovarian cancer are going to develop sexual dysfunction or problems with having sexual relations. That's something that we know from many studies. And there's several reasons for that. One of the biggest reasons is body image issues, simply because after a big surgery, you're going to have a big incision on your abdomen, and that's obviously not something that most women want to have. The removal of the ovaries are kind of the brains behind the sexual operation in women, and once you remove those, a lot of that drive for sexual function unfortunately goes away. Side effects of treatment. Chemotherapy is very exhausting, and one of the biggest side effects that women have when they're getting chemotherapy for ovarian cancer is going to be fatigue, and so you're constantly anemic and constantly fatigued, you're not going to want to have intimate relations. So those are some of the things that happen to women as a result of treatment for ovarian cancer with regards to sexual intimacy. And so one of the biggest things that I hear from women are really kind of twofold. It's more the psychosocial aspect, and then there's the physical aspect. So from a psychosocial point of view, one of the things that a lot of women talk about is just feeling like less of a woman after surgery and chemo for ovarian cancer. And one of the things that, you know, I've done for Ovarcome before, as I've talked about my book, is one of the things that you hear a lot about is women who complain about losing their hair. Hair is such an important part of how a woman feels like a woman. And so when you lose your hair and you take that away from a woman, there's really only one reason in our society why women don't have their hair. It's because they have cancer. That means that they're sick and unhealthy, and maybe they don't feel like they're as attractive. So that's a huge psychosocial aspect of why women who have ovarian cancer are going to have a decreased libido or lack of desire for sexual intimacy. And then, as I said before, the physical aspects of it, you know, the fatigue, the scar tissue from surgery, those things are all things that can do that.
And you mentioned the hair aspect, which is so important because we've had one survivor that I was talking to. She actually mentioned that if I did not lose my hair and had to go to the treatment, it would not impact me as much as it did when I lost my hair, because it's such a visible sign of, you know, you going through treatment or having cancer, that it's just very unsettling for survivors. So.
And the expectation for women is very different than it is for men. For a lot of men, as they get older, there is an expectation that you're going to lose your hair. Not all men, but a lot of men. And so there's a certain feeling of, well, I'm becoming more older, I'm becoming more distinguished. You know, it's an expectation. Whereas for most women, 95% of women, that is not an expectation that they're going to have. So it's quite moving for a lot of women and quite devastating for a lot of them.
Absolutely. And what should the care partners know about the changes women go through with an ovarian cancer diagnosis, be it emotional, physical, or even spiritual? And how can a spouse or significant other become a part of this journey with greater understanding and tolerance? And could you share like 3 simple tips with the partners to make them more engaged in this process? And maybe even keep the romance and the love ongoing despite the physical challenges that overcomers might face.
So I would say 3 things that you could do. The first is, you know, communication is so important. And that's like a very kind of overused thing that we say, well, communicate. But really in this situation, there's probably no other thing that is more important to regaining sexual intimacy after a diagnosis of ovarian cancer I always remember a couple that came into my clinic a few years ago where she had finished treatment, and I asked her at the end, I was like, well, have you started having relations again? And she said, no. And her husband didn't say anything. And I was like, well, do you want to? And she said, yes, I've wanted to since cycle 2 of chemo. But he didn't bring it up, so I didn't bring it up. And there was this kind of, like, they were going like this, and there was this huge disconnect between, a couple that had been married for 30 years because one person didn't want to bring it up because they didn't want to seem like that was what was on their mind, and the other person didn't bring it up because because the spouse didn't bring it up. So I think that that is very important to have those conversations. How is this going to change our intimate relationship, and what can we do going forward to build that? So communication. The second thing, and I can't emphasize this enough, and that is using a good lubricant. Using a good personal lubricant during relations is one of the least expensive and most cost-effective ways to repair sexual intimacy. After we do surgery and after we remove the ovaries for ovarian cancer, one of the things that we see is that the vaginal area becomes quite dry, and as a result, sex becomes more painful. So one of the things that we want to do is prevent that, and one of the ways that we can do that is by using or recommending a good vaginal lubricant. And the last thing is setting expectations. So, after a diagnosis of ovarian cancer, expectations are going to be different on both sides of an intimate relationship. So set those expectations. What might have been pleasurable before treatment may not be pleasurable afterwards. So having that discussion, I think, is really important.
And for younger women that have been diagnosed, what advice would you have for them as they step out into the dating world after chemotherapy, surgery, or even survivorship?
So one of the things that I would say is to be very honest. When I've given talks all over about this topic, and one of the things that I hear is it's very difficult to date. Like, it's different if you're in an intimate relationship to start with, but what if you have ovarian cancer and you're not in an intimate relationship, and then you want to be in one later? So I think it's very important to be honest that, it is different, and it is going to be a little bit maybe more challenging for that person at first. But I think that again, that communication and that just being very honest that, that this part of something that might be quote unquote normal to one woman may be a little bit different for someone that's a cancer survivor.
Switching gears just a little bit, you have done such a tremendous study on IUDs and ovarian cancer, and paper was published and it was all over the press. So it has been linked to reduced risk of ovarian cancer. And can you tell us more about this significant study, and what does it mean for our overcomers and survivors?
So the study that we did was what we call a meta-analysis. So we took data from many different studies and compiled them into one to look at what is the magnitude of the effects of using an IUD to prevent ovarian cancer. And what we found is that in women that have had use of ovarian cancer, we could not quantify how long that effect would need, how long use of the IUD would need to be to have the effect. There was an up to a 30% reduction in the risk of development of ovarian cancer in women that had ever used an IUD, and this included IUDs that are hormonal, metal, stainless steel, all these different kinds of IUDs that are used over the world. And obviously we are happy that we found that, but we do approach that data with some caution. It's not a randomized controlled trial. It's a trial that basically took different IUD types from all over the world and combined all of that data into one, and then found kind of a size effect from there. So there are definitely some problems with the trial, but I do think it is what we call hypothesis generating, and we do believe that there is most certainly a protective effect for the use of IUDs to prevent ovarian cancer. There's a lot of biologic basis for that.
So just so we understand this, this is a prevention tool, and so it is meant more for the general population of women, correct?
Correct. So a 31-year-old woman who has to talk to her doctor about what type of contraception she would use. Should she use pills? Should she use sterilization? Should she use a copper IUD? Should she use this? I think that this is part of that discussion. Well, I read that this doctors in Denver did this study which looked at using IUDs, and one of the non-contraceptive benefits was prevention of ovarian cancer would be, I think, great.
And I don't know whether your study included this, but if a woman has the BRCA gene, but she hasn't been diagnosed with ovarian cancer yet, but she knows that she carries that family history, that genetic risk. Even for those kinds of women, this is relevant, or do
So
you?
we didn't look at specifically BRCA positive young women. We think there's probably a benefit in those patients theoretically, but we didn't specifically look at that.
Okay. And back to the intimacy factor, what is your guidance on professional counseling on intimacy issues for ovarian cancer patients and survivors? Tell us about the barriers that they might be facing and how might they navigate the barriers.
So one of the barriers that I think that women face is embarrassment. There are a lot of women that don't want to talk about that for several reasons. They might just culturally not be something that was talked about a lot in their household. It might be embarrassment because they don't want to bring it up with their physician because they don't think that they can have that type of conversation with their physician. Time is a huge barrier when you go in to see your doctor. Most physicians sadly don't have all the time that they want to give to their patients, so they want to concentrate on things like recurrences and side effects of chemo, so they don't bring it up. So there are a lot of barriers, and I would say one of the biggest is that physicians don't make it a priority. And I'm not saying that until I got interested in the topic, I don't think that I made it as much of a priority as it should be. It is an important priority. But those are some of the barriers that I think a lot of women are going to face.
This is related to the COVID-19 outbreak. So with all this going on, what guidance would you give to overcomers in terms of safety precautions with intimacy while we all face this COVID-19 crisis?
So ovarian cancer patients are in a higher risk group, particularly women that are currently on chemotherapy, or if they're on PARP inhibitors, if they're on maintenance chemotherapy for whatever reason, or primary chemotherapy. They're going to be at risk they're going to be in that very high risk group because they're going to be immunocompromised. So I would very strongly recommend that people watching who are in active treatment, please use your standard, precautions that you're hearing from all of the physicians and the people on TV. Use hand sanitizer, wash your hands. We can't say that enough. Use a mask when you go outside. Make sure that you're keeping your social distancing 6 to 8 feet away from people. I would not go into big crowds right now. I would try to avoid non-essential travel. I mean, we can't say that enough, and we're not saying that because we want to trap people, but we really, for someone that's neutropenic or is immunocompromised because of chemotherapy, to get COVID-19 would be very dangerous.
Absolutely, and this definitely presents a challenge, even in terms of intimacy and other things. But at this point, as you said, it's important to stay safe and take the necessary precautions. So, absolutely. My last question, bringing it all together, please share something positive with our listeners and tell us what would be your parting message for our survivors and overcomers.
Do you mean kind of generally or kind of in this kind of space that we're in right now?
Both.
I just continue to be inspired. Our practice obviously over the last several weeks has dwindled by a lot simply because we're trying to triage patients and not bring them into the hospital. But I am just continue to be amazed by our ovarian cancer patients who continue to, despite being sick from chemo or post-op or having all these other issues, just continue to be so positive and continue to be an inspiration for me every day when I come to work, simply because they want to continue with their therapy or they want to participate in research. We just had a patient that said, can I make a donation so we can look at how COVID-19 specifically looks at ovarian cancer patients? And I was really amazed by that somebody wanted to still think about what they could do to make the ovarian cancer landscape better in a very difficult time when so many people are going to be counting every penny, when so many people are not going to be traveling or seeing their family, that ovarian cancer patients are part of this sorority of women that still want to do so much. And that's still so amazing to me. I'm always awe-inspired by our patients.
Mm-hmm. Thank you so very much, Dr. Guntupalli. This was great information, and if we do have any questions, we'll make sure to bring it back to you so that you may address. And thank you, Overcomers. Thank you so much for watching, and we'll be back with our next episode of Connect Over Coffee very soon. Till then, take care. Bye.